Okay, Becky, you can start.
Hi, everyone. My name is Becky, and this is my story of how I went from being a cancer patient to becoming a healthcare professional. So to start off, who am I? I am going to be starting my third year at naturopathic medical school, and I do have a passion for integrative oncology, so that will be my focus once I become a practicing naturopathic doctor. So I just wanted to put a disclaimer just before we get started with the presentation. This is my own personal experience and it's not meant to be taken as medical advice. Please seek your healthcare team for any medical inquiries. And then I also want to be sensitive because I will be sharing my own cancer journey. So if at any time there's something that is potentially triggering, please know that you can take a break and join back later. And I promise that there is a happy ending. So how did I get here? My journey started when I was 14. I was admitted to Sick Kids and I was diagnosed with a rare condition called myasthenia gravis. Now, this is an autoimmune condition. It causes weakness in all voluntary muscles of the body. So from a young age, I was going to the hospital every month, getting infusions, trying different medications, trying to live as normal of a life as I could while being in high school. I also had what's called a myasthenia crisis, which I was in the hospital for 11 days. I went into septic shock, and it was a lot to deal with when I was such a young age. But I will say my experience at Sick Kids was amazing, and I'm so thankful to all of my nurses on 4C that I would see every month when I had my IVIG treatments. And then I also had amazing doctors there, such as my neurologist and his nurse. They always made me feel so safe and taken care of. And I always remember this one nurse on 4C. She told me this one day, and it really stuck with me to really advocate for my health and to not be afraid to speak up. And that would be really important in the next few years to come. So my passion for advocacy started about halfway through high school. When I was first diagnosed with myasthenia gravis, I was a little embarrassed, to be honest, because not very many people knew what it was. It was a very rare condition. It was mostly seen in the elderly population, so I just really wanted to hide away. But when I turned 16 and I was in grade 11, I decided, no, I need to advocate for this condition and I really want people to understand what I'm going through. So I had the opportunity to do a TED Talk, which was an amazing experience. So after high school, I pursued a Bachelor of Science in Medical Sciences and I attended Brock University. I moved 2 hours away from home, which in high school was something that I never thought that I would have been able to do. The amount of things that my mom had to do for me when I was in high school, I couldn't really take care of myself. So the fact that I was able to live on my own and be so busy volunteering and doing such hard classes. I was really proud of myself. But when third year approached, I noticed that something wasn't right. Never in my wildest dreams would I have thought that this would be what the first day of university would look like compared to the last day of university. So this journey started in 2020. I had decided to go on birth control because I had been having very irregular and very painful periods for basically my whole entire young adult life. And I just wanted to see if it would help me. That summer of 2020, I decided to come off of the pill because it wasn't really working for me and I was experiencing just different side effects that I just knew that something wasn't right. So then in November of 2020, I went off of the pill in August of 2020, and I was told by my family doctor that it would take a couple months for my cycle to regulate, but I was still noticing that my cycles were very painful. They were regular, but I was noticing this very brown, smelly, almost like fish smelly discharge in between my cycles. And so I went to the doctor, they did a swab and they did an ultrasound and they determined that I had bacterial vaginosis and the ultrasound was clear. So I was sent home with an antibiotic. In December of 2020, I had a blood clot during one of my cycles that was very large, and I continued to have this brown discharge in between and such an intense amount of pain during my cycles. So I was given another round of antibiotics, but the discharge never went away. At the beginning of January, I thought I was getting my period and I was having the most intense pain. I tried everything from Tylenol, ibuprofen, Motrin, and nothing was helping. I was soaking through overnight pads every 10 minutes, and I knew that something wasn't right. So I decided to call the ambulance. And they came, brought me to the hospital, and I wasn't believed at the ER. I had a very traumatic experience this visit. I had a nurse tell me to get up off the stretcher because um, she wanted me to put on my big girl pants, and it was just not a healthy situation. I waited for an ultrasound. I was given some pain medication, and I decided I just needed to go home and sleep off the pain, but I ended up back at the hospital that night. I finally got the ultrasound, and they determined that I had two small fibroids in my uterus, but they did want me to get a MRI the next week just to make sure everything was okay. Well, on January 11th, I didn't make it that far. I ended up back into the hospital because I was having severe leg pain and I felt like there was this mass that was hanging in my vaginal canal. So I decided to go back to the hospital. They did an MRI and they found that my uterus actually inverted. So this picture over here is what a uterus looks like normally on an MRI. So this is the top of the uterus, which is known as the fundus. And this is my MRI, and this is where the fundus of my uterus was. So it completely turned inside out, and that was because a large mass where those two masses the week before had fused together and essentially sank in my uterus. I ended up having emergency surgery, which was originally supposed to be laparoscopic, but the incisions that they made were too small to be able to reconstruct my uterus. So at the time that they did this surgery, they had told me that it was a very, very rare chance that this could be cancer. They did send away the mass for further testing, but I was assured that everything was going to be okay. I would go back for a follow-up in 6 weeks with my gynecologist, and my life would go back to somewhat normal. But I ended up getting a call a week later from my gynecologist, and his receptionist asked if I could come in with my mom the very next day. On January 26th of 2021, I was diagnosed with uterine embryonal rhabdomyosarcoma, which is a very rare cancer, especially in the uterus. At the time of my diagnosis, I was told that there was only ever 20 documented cases in the uterus. So then February 10th, I was referred to a gynecologist, oncologist, and I had a hysterectomy, which I think this was probably the hardest part of my cancer journey, knowing that I would never be able to become pregnant. That was something that I really wanted and I saw in my future, but unfortunately, I did have to get my uterus removed. But I will always remember waking up from that surgery and how devastated I was. And the anesthesiologist that I had and my gynecologist, oncologist, they both sat with me and they talked me through it. And they made me feel so much better in such a horrible situation. And I will be forever grateful to them. I did have to be referred to Princess Margaret as it was such a rare cancer. And my oncologist that I had where I live, she didn't have much experience with this cancer, so I was referred to the sarcoma clinic. And I also flip-flop between the gynecology department as well. I did fortunately have the opportunity to freeze my eggs, so I underwent IVF. There was a point at the beginning of the journey that we weren't sure if I would even be able to undergo the treatments just because I was on this one medication at the time for my other condition that might have made the quality of eggs um, be diminished. But thankfully, I was able to get through the procedure and I did successfully freeze 30 eggs. So I do have a couple of videos just kind of when I was going through this, I documented. So today I'm showing you my fertility treatments, what I've been doing the past week to prepare for egg retrieval. So I'm 21, I've been diagnosed with cancer, and I am freezing my eggs before I start chemotherapy later this month. So I've been giving myself a shot every day this week and 2 shots the past 2 days. So the first shot is to stimulate my ovaries to produce more eggs, and the second shot is to stop me from ovulating before the actual egg retrieval procedure next week. And then this was what a typical day would look like. A day in my life as a cancer patient, fertility edition. So every appointment when I get there, I have to sign 3 clipboards, one for blood work, one for an ultrasound, and one to see the doctor. Today I did the ultrasound first, it was pretty long. Then I went back and did my blood work. And then after I was done my blood work, I waited for the doctor. Then I saw the doctor, everything looks good. And then after that, I went and saw the nurse and got my injection, and then I went home, ready to tackle another day. I'm so grateful that I was able to freeze my eggs, but I will say that it was a very emotionally taxing and physically taxing, and my heart goes out to anyone that has to go through this process. So today and then after I froze my eggs, I got a port inserted to prepare for chemotherapy. And then I also had one additional surgery called an oophoropexy. And this is where they relocated my ovaries so that they would be out of the field of radiation. Because if they were to radiate my ovaries, then I would have gone into early menopause. So my first regimen of chemotherapy was VAC. So this is a combination of vincristine, actinomycin, and cyclophosphamide. This is a very, very heavy-duty chemotherapy regimen, and the initial plan was to do 14 rounds. So this is a picture of my first round. I really struggled on this chemotherapy regimen. After the first round, I actually developed febrile neutropenia, and I spent about 4 days in my local hospital. This was also at the height of the pandemic, and this was when a lot of patients were being shifted between hospitals. So a lot of patients were being shifted from Toronto to other hospitals, and I actually was in an overflow room. It was supposed to be an office. I had this little bell as my call bell, and it was a very interesting experience. I can now laugh about it a little bit, but it was it definitely added to the trauma. I also started to lose my hair during this visit. And I seemed to experience a lot more unusual side effects every time that I would go to my oncologist and I would tell her this new side effect that I had been experiencing. She would say that it wasn't a typical side effect that she had seen. Not very many of her other patients had experienced this. An example was I used to get these really, really hot cheeks where my cheeks felt like they were on fire. The only thing that seemed to help was taping cucumbers to my face. And then the other thing was I was fatigued all the time. I was told before starting chemotherapy that majority of patients on this regimen, it was every 3 weeks that you would get a dose. The first week after the round, you would feel really exhausted, and then most patients the next 2 weeks after that would be able to live a somewhat of a normal life, but I was just constantly tired. And then I underwent 5 weeks of radiation. And into my third week of radiation, I was hospitalized. I developed a staph infection in my port. At the time, I was on chemotherapy and radiation at the same time. I had multiple blood transfusions. I had the port removed. I had a PICC line inserted. And then I was also on IV antibiotics for 2 whole weeks. After radiation, I seemed to just not be able to get my energy back. I developed this rare blood condition where my platelets were chronically low. So we were always trying to increase my platelets. So I took a little bit of a break from chemotherapy. I had to get multiple blood transfusions and I got a new port. Because my platelets were so low, I wasn't able to continue with VAC. So my team decided to put me on a maintenance chemotherapy regimen, which included oral cyclophosphamide and IV vinorelbine for 6 months. And during all of this, I started to see a hematologist because, like I said, my platelet counts just did not ever come back up. I also had a very high bilirubin value. So we did some investigations, we did bone marrow biopsy, we did lots of blood work, and it turns out that I was diagnosed with Gilbert syndrome, which is just a genetic condition that caused the high bilirubin, but then also Evans syndrome, which is a combination of ITP and hemolysis. So in ITP, it's the immune system attacking the platelet count. So my platelets are chronically low, and we're not really sure if it's the staph infection that triggered it, but it just seemed to coincide with the infection. And then, like I said, fatigue was something that I really, really struggled with. I remember the last couple weeks of radiation, I was staying at a condo across from sick kids, and the walk to Princess Margaret was only about 10 minutes, and I had this little walker, but I would have to sit about 3 times on that short walk because I was so exhausted. And I feel very fortunate that I was able to be a patient in the survivorship clinic, and then I was referred to Toronto Rehab, where I did 6 months of physiotherapy and I also did some occupational therapy. And that was really key into helping me get back the energy and endurance that I had lost. I always like to include this little slide because it is a proud moment. This is when I rang the bell. I had officially finished treatment, and it was the same day that my oncologist said that I was officially cancer-free.
Congratulations.
But then a couple months later, so when I was undergoing treatment at Princess Margaret, I did have a PET scan, and they showed that there was a nodule in my thyroid. Now, my oncologist said that it was probably benign, but one of my surgeons, she really advocated for me, and she referred me to Women's College Hospital to an endocrinology surgeon because she said with my history that it would just be a good idea to get everything checked out. So while I was going through chemotherapy and radiation, I did have 2 fine needle aspiration biopsies, which both came back inconclusive. And then I had a couple of ultrasounds a few months apart. And the last ultrasound that I had, the mass had grown, the nodule had grown. So my surgeon deemed that it was probably the safest bet to take out the right lobe of my thyroid and get the nodule tested, which it did turn out that this was Hürthle cell carcinoma. But luckily, I did not have to have any further treatment from there. And then this is just kind of a broad overview of every person that was a part of my healthcare team. I really like to emphasize that it's a team-based approach. I think in integrative medicine in general, knowing that there is so many different players in one person's care and that everybody has their important role. So for me, it started out with my family doctor, my neurologist, which I already had beforehand, and then the ER doctor, which referred me to the gynecologist. The gynecologist referred me to the gynecologist oncologist. And then that oncologist referred me to the medical oncologist. And then the medical oncologist referred me to the radiation oncologist. And then so many other key players that were so important in my care, like the fertility specialist, the psychiatrist, hepatologist, physiatrist, naturopathic doctor, urogynecologist, the endocrinology team, the hematologist, the cardiologist. There's just so many players that all have a piece to the puzzle. So, life after cancer with survivorship, I think it's an ongoing thing. And there's a lot of things that, as a survivor, um, you do have to go through. One of the big things is medical trauma. I still to this day am processing everything that I've gone through. Some days I can, get past it, and then some days I am triggered by something. And I just think it's an ongoing healing process. Also, with not feeling like I was believed, that is something that I continue to deal with. And then fatigue and chemotherapy side effects in general, that is also lifelong. I know in one of the support groups that I was a part of, a nurse that ran the support group, she said that chemotherapy and cancer fatigue lasts 5 years post-treatment, which is pretty crazy to think about, but it's something that I continuously have to listen to my body and just know that all that I have gone through, just be reminded of all that I've gone through. And then accepting a new normal, knowing that my life before cancer, my life isn't going to be the same after cancer, which can be a good thing. I do feel like I appreciate life more and I live life more intentionally, but there's the other things like family planning and knowing that, for example, that's something that is going to be different for me, just working through that new normal. And then also, very commonly, the fear of recurrence, especially every year going back for scans, hoping that everything is still clear. And then, like I mentioned earlier, family planning, especially for me, is going to look a little differently, but I know that I'm going to make it my own. And then health optimization, making sure, in my case, always knowing to take care of myself, knowing to not like stress myself out over small things, and just really taking care of my body because it's been through a lot. And then also self-discovery. I really found in my early stages of survivorship that I felt really lost because I had almost taken the identity of being a cancer patient because every week I was having so many appointments and I was living the day to day by each appointment milestone. And then after ringing the bell and not having as many appointments, it was kind of like, what do I do now? And so it's taken me some time to figure out who I am without cancer as well as who I am after cancer. And then also in regards to medical trauma, I have had some bumps in the road after cancer. In March 2023, I did have emergency surgery for ovarian torsion. I didn't know at the time when I had my oophoropexy, when they relocated my ovaries, that I was at an increased risk of ovarian torsion. So sadly, I did lose one of my ovaries, which brought up a lot of things that when I had my hysterectomy I was feeling. So that was something I really had to work through. And then this past month, I did have a cardiac ablation for Wolff Parkinson White syndrome, which I had actually been diagnosed with this on a random ECG that I had before one of my surgeries for cancer. So this was another thing that I had to deal with, but I am happy to say that as of this morning, I've been discharged from the cardiologist, that the procedure was successful, and I am now healthy and moving on to bigger and better things. And speaking of bigger and better things, during the most difficult time in my life, I found purpose. I had actually applied to naturopathic medical school the the year before I was diagnosed, and I was supposed to start. I had just gotten my acceptance letter a month before I was diagnosed, and I was supposed to start that September, but I knew that I was going to be undergoing a year of treatment and that I needed some time to heal. So I did end up deferring my offer. So I am actually going into, like I mentioned earlier, my third year, and I've had so many unique opportunities. I am actually a rep for a supplement company that they have a whole integrative oncology line, and they have a whole board of naturopathic doctors that um, they research these supplements and blends, and they even give them to their patients, and they do case studies. And it's just been really fulfilling to work with so many amazing people in this field and knowing what's out there to offer, especially for side effect management. I've also had the opportunity to shadow in the clinics at my school, and I've also had the opportunity to attend conferences. This one in particular in this photo was from last summer. It was a full integrative oncology conference, which I learned so much and I connected with so many amazing people in this field. So my goal in the end is to start my own clinic, and I want to focus on both autoimmune diseases and oncology. And I just want to help these patients thrive. I remember taking a clip of myself because I documented a lot of my journey, and this was when I really had to think about deferring my offer to school, and I was just in such a state of grief, knowing that I wasn't going to be able to start the program with my friends. And I remember just saying, like, all I want to do is thrive. And I've gotten to that place. And all I just want to do now is to help others thrive that are going through a similar situation that I did. And I also want to emphasize quality of life. I think that's super, super important. And to partner with MDs and the rest of my patients' healthcare teams, because I truly think that it takes a village. So if you've never heard of naturopathic medicine, here is a little rundown. So naturopathic medicine is based on 6 principles. So the first of that is to do no harm, also emphasizing the healing power of nature. We also identify and treat the causes rather than treating the symptoms. The physician as a teacher, treating the whole person and not just treating the disease. And then prevention. Prevention is a huge one. And then some of the modalities that naturopathic doctors do offer is like nutrition counseling, lifestyle modification. So this could be improving sleep hygiene, targeted exercise therapies, also acupuncture and traditional Chinese medicine, hydrotherapy, supplementation, various physical therapies, and patient education is a huge one. For example, teaching patients the proper nutrients to get into their body, and just various lifestyle things, like I said, with like sleep hygiene. And then health psychology, we're here to listen to patients and to make you feel heard. Botanical medicine is another one. And There is really an emphasis on the integrative approach, so combining conventional medicine with traditional naturopathic medicine. So this is my journey and how naturopathic medicine helped me through my cancer journey and beyond into survivorship. I know everybody's experience is going to be a little different, but these are some of the examples of how naturopathic medicine really helped me. Side effect management was huge for me. One of those being nausea associated with chemotherapy. Now, when I started the maintenance chemotherapy, I had noticed that the one anti-nausea medication that I could take as needed after the round of chemotherapy was causing a lot of these interesting side effects, like the flushing of the cheeks. And I was also feeling really dizzy from it. So there was a supplement, for example, that my naturopathic doctor prescribed to me, and I would take that after. I would obviously still take the anti-nausea medication the day of, but if there was a couple days down the line after the round of chemotherapy, I would take the supplement first, and then if it didn't help, I would obviously add on to with the anti-nausea medication, but there was quite a few times where I did not need the anti-nausea medication. The supplement that I took was effective, and I avoided some of these side effects. Another huge one is fatigue. So some possible targets is sleep hygiene, so making sure that I was getting enough hours of sleep. What was preventing me from being able to fall asleep, that was a really huge one for me. Healthy habits before bed, like exposure to screens before bed. How long before that was I looking at screens? Also having a realistic exercise plan. There's never one exercise plan that fits all. Everybody has their own modifications that they need. An example is at the center that I went to, there was a yoga therapy class that I attended some sessions, and it was really focused on modifications and doing what you could. And this was really helpful in helping me integrate into more advanced exercises. Stress management practices such as mindfulness, meditation, journaling, and then acupuncture. And then for anxiety and depression, I was really anxious, especially during my treatment. So some of the targets that helped me was talk therapy, supplementation when needed. That was a huge cause of my lack of sleep. So having a supplement that I could take before going to bed that would help me feel more relaxed. And then some like lifestyle modifications, again, with like the sleep hygiene, exercise, all of that. And then also acupuncture can be helpful in anxiety and depression. And then more recently, something that's been a focus in my care plan is surveillance for any hormonal changes, because now that I only have one ovary, we're continuously monitoring me to make sure that I'm not experiencing symptoms of early menopause. And if I end up experiencing symptoms of early menopause, then we can talk as a team about like hormone replacement therapy and what that kind of looks like. And then nutrition is another big one. I found it really helpful that I had a lot of guidance into, for example, when I was on chemotherapy, how much protein I should be getting, and then even beyond into survivorship, what kind of things I should be fueling my body with, depending on my own individual goals. And then, like I said, improved fatigue and endurance. So the difference between these pictures are night and day. If you would have told the version of me in this first picture that I would be at the gym lifting weights, I probably would have laughed. I wouldn't have believed you, never in my wildest dreams did I think I would have ever been able to go to the gym and regularly exercise, but putting in place a exercise plan for me that was slow and putting exercises into my workout regimen that didn't make me feel as fatigued, that would actually give me energy, made the world of a difference. And then again, I have passion for advocacy, and I did end up documenting my whole entire cancer journey on both my TikTok and my YouTube channel. And when I started doing this, I just really wanted to spread awareness because, like I had said, I was not believed when I was at the hospital. I had a very poor experience that first time that I walked into the emergency room. And from that point on, I have had nothing but great doctors, nurses, um, physiotherapists, just all healthcare professionals that have treated me with such kindness and such grace. But that one first experience still sticks with me to this day. And when I started sharing my journey, I just wanted to bring forth that awareness so that nobody had to go through the experience that I had to go through to get a diagnosis. So I have gotten a lot of positive feedback. I've connected with so many cancer patients, family members of cancer patients, and I said to myself at the beginning, if I helped one person by sharing my story, then I was doing my job. So I think I have accomplished that. And then I also used my voice in some other opportunities during my cancer journey. So I campaigned with Look Good, Feel Better. I did an article with them. I also did some articles with some cancer pages on Instagram. And then I was also an ambassador for Tough SOB, which is a nonprofit organization. So this is what I know for sure. There is a reason that I'm here to share my story. And if you're going through survivorship at this time and it feels confusing, there is life after survivorship. And there's life after survivorship no matter the number of setbacks. And I really feel like I'm here to help others and make them feel seen by their healthcare professional and to help guide them towards the life that they are meant to live. And I believe that I am living proof of that. So thank you so much for attending this talk. If you have any questions, feel free to ask.
Hi, Becky. I have a question for you. Sorry.
Yeah, go ahead. Go ahead.
Do you have any advice for cancer kids that want to get into the medical field?
Yeah, so I would say in high school, um, I volunteered at the hospital for quite a few years in high school, so I was able to see different professionals in a hospital setting. I think in high school, though, shadowing might not be an option, but if you're going into university, always ask to shadow if you know of a contact, if you know of a doctor or a physiotherapist or a naturopathic doctor in the area that you want to learn more from. I would always say to reach out to them. A lot of healthcare professionals are very open to sharing their experiences. I know in undergrad, when I was part of the Med Plus program at Brock, I did some shadowing. I shadowed a physician's assistant, a surgeon. I was supposed to shadow a naturopathic doctor at that time, but with the pandemic happening, I wasn't able to. But I really learned a lot from those experiences of what I liked from those careers and maybe what I didn't like. So always looking for those kind of opportunities, I would say.
Thank you, Becky. I have from a comment here from Carlos. He said, "Thank you, Becky, for sharing your story. You have been through a lot, but you are so brave and have a very positive attitude. This positive attitude has certainly helped you along the way. You are an inspiration for other cancer patients. Thank you again for sharing your story. I'm sure that once you graduate, you will be able to help hundreds of patients. So,
Thank
thank
you
you.
so much. That's so kind.
Very good. Are there any questions for Becky about her cancer journey, survivorship, or naturopathic medicine? Have you had any experiences with your kids with this? Or Becky, how can it help naturopathic medicine, the children, maybe specifically, or how do people get in touch with a naturopath if they're interested in learning more for their child?
So there are a few naturopathic clinics that I would recommend just based on their experience and that cancer is something that they really focus on. So my naturopathic doctor is actually based out of the clinic at my school. So it's the Cancer Center at the Canadian College of Naturopathic Medicine. So you can always book an appointment on their website, or you can even book a discovery call, which is like a free 15-minute call to see if they'd be the right fit for you, which I do recommend doing that if naturopathic doctors have that option, the ones that you're looking into. Another one is the Marsden Center. They're probably the biggest one in Ontario. They're based out of Vaughan, and they have a lot of naturopathic doctors, and then they have acupuncturists, and they have a whole team there. So yeah, and then to answer the question for the pediatric population, I do think side effect management is a really big thing. I think that can be helpful for both adults and pediatrics. And then also into survivorship, being able to get to that transition and being able to get back to being a kid.
Great, thank you. If you have any questions for Becky, just feel free to type them in the chat and I'll read them, or just chime in. In the meantime, Becky, while we wait here, yeah, thank you so much again for sharing your story. You have been through a lot, but I'm sorry that you went through that negative experience, your first one. But you've transformed it into something wonderful as far as helping others, advocating for other patients, and finding your purpose with naturopathic medicine. So that's wonderful. Very good.
Thank you.
Mhm.
Can you hear me?
Yes.
I have a
Yes,
question.
sure.
My son is 16. He has had radiation at Princess Margaret before. He's a brain cancer patient. Do you have any advice for kids who are moving from Sick Kids on to Princess Margaret or other adult hospitals? Do you have anything you can let them know or tell us a little bit about that transition? Because it is a nerve-wracking time for a lot of people.
Yeah. I did do that transition. It was before my cancer, but I I struggled a little bit with that transition. I think just being open with the new doctor and laying out those expectations of, because I had a really great doctor at Sick Kids and they went above and beyond. And when I met with my adult neurologist, I really just wanted to be clear with the experience that I had with my old neurologist and kind of like my expectations going forward. I know it's a scary transition because Sick Kids is an amazing place, and I honestly wish that I could have still been a Sick Kids patient. I also feel like I'm lucky because a lot of my doctors are still stem from Sick Kids. Like my oncologist, she actually is an oncologist at Sick Kids and Princess Margaret. So I feel very safe with her because I know that you have to be a special person to work at Sick Kids. So yeah, I think just be kind to yourself and make sure that there's communication between the team and knowing that there is certain things that you expect from the new neurologist. That was your experience at Sick Kids. I also stayed in contact with my doctor from Sick Kids, so I also felt comfort in that I wasn't immediately cutting ties. I don't know what each person's individual relationship was with their doctors from sick kids, but I still talk to my neurologist, his nurse. She follows me on Instagram, so I still keep in contact with her. So I still feel like I have that connection. And even before the pandemic, I was visiting sick kids all the time when I would come see my adult neurologist. So I didn't really feel so far away. I was just across the street. So I hope that helps.
And Shannon, I
Yes,
know that,
thank you.
sorry, Shannon, I know OPAC did a talk with someone from, it was like a year or two ago. I'll have to look it up and I can send you the link, because we did a chat like this with someone from Princess Margaret. They have a special clinic or a special department to help people or kids transition from pediatrics to the adult care system. And definitely
Okay,
it is stressful. So I'll send it to you, Shannon.
cool. Thank you so much.
Yeah, you're welcome. Any other questions or comments for Becky? All right. Well, I think that's it, Becky, then. Again, thank you very much for being here tonight and sharing your incredible story. This talk will be up on our YouTube tomorrow. So if you want to go back and revisit anything that Becky said, we'll share the link on our social media. And of course, you can visit OPAC, opacc.org, our website, for more information, resources, and support for childhood cancer families. So thank you again, everybody, tonight for joining us, and for Becky as well. Oh, sorry, Becky, there was a quick question here from Susan. Thank you for sharing your story and all your great suggestions for families looking to potentially meet with a naturopathic doctor and any other alternative therapies. It's important to have a conversation with your child's team. Yes, important indeed. And I think, Becky, you mentioned that in the disclaimer at first. Everybody's story is different, and make sure you consult with your child's healthcare team as well. Right. All right. Thank you. Take care,
Thank
everybody.
you so
Good night.
much.
Thank you. Bye.